Hello, it's Dr. Aaron. I am back. It is Friday at 5:30 and hoping to see some of you guys pop on. I'm glad to educate you guys on a Friday. So today we're going to be talking a little bit about IV vitamin therapy. I'm sure you guys have heard about this, seen some news articles. I know in Las Vegas they have these hangover IV buses that come around. There's an article in the Vancouver Sun this week that talked about one of the IV clinics here in Vancouver, and I know people have questions about it. So I wanted to just give a little bit of brief idea of what that is, what a Myers cocktail is, how you can use vitamins to help with your energy levels, keeping your immune system strong, and so yeah, that's what we're going to do. So again, my name is Dr. Aaron. I am a naturopathic doctor, which means that I do things from the nutritional herbal end, but I can also prescribe medications if needed. And so I love helping people. And I can only help a limited amount of people when I'm in my office, but when I'm doing videos like this, I'm hoping that one day I'll be able to reach out to even more people and help them on their journey. So I want to refer back to the Vancouver Sun article. The Vancouver Sun article talked about the controversial nature of IV vitamins, and they had a PhD nurse on there talking about there being no research for IV vitamin therapy, and that it's a waste and that it all pees out. So you know, there's some truth to some of what he had said, and I want to address a little bit about that. But before I do that, let's talk a little bit about what IV vitamins are used for. So IV vitamins have been used probably since the 60s and 70s by various groups to help restore nutrient deficiencies, probably even a little bit earlier. Medical doctors use things like TPN, or total parenteral nutrition, which is a combination of vitamins, minerals, and fats in an IV solution, and they use this in a hospital setting. The total parenteral nutrition is meant to give a person basic needs for them to function at a very low basal rate. So it has a little bit of protein, a little bit of fat, a little bit of carbs fed through an IV. Most of the IV vitamins that you're going to get at a naturopathic doctor's office aren't going to be the total parenteral nutrition type. They're going to be either vitamin and mineral-based IVs, amino acid-based IVs, or they can even be fat-based IVs. The most common one that you're going to read about are the Myers cocktails. The Myers cocktails was developed by a Dr. Meyer, a medical doctor, and what he noticed is individuals that were suffering from fatigue and low energy benefited from getting a combination of vitamins such as vitamin C, a specific form of B, which is B5, B6, B9, B12. So B9 is folic acid and B12 is... So he used a mixture of these vitamins, including a few minerals like calcium, magnesium, and selenium, and he infused this over a period of 15 minutes to a half an hour, and it helped individuals restore their energy and improve their immune system. And so the two main systems in the human body that are affected by high dosages of vitamins, which is what this is, are the adrenal glands. So the adrenal glands sit on top of our kidneys, right in the back. They have multiple different functions. The main function here is dealing with cortisol and balancing stress and helping us adapt to stress. And so vitamin C works really well. It's a vitamin that's consumed in high amounts in the adrenals, including certain vitamins like vitamin B5, magnesium. So there's a lot of metabolic processes and hormone-related processes that happen in the adrenal glands that are supported by high-dose vitamins. The other area is the immune system, so leukocytes and white blood cells need vitamin C to work. So the high-dose vitamin C's in some cases can really help ward off infections, keep the immune system strong. An area that I'm not too familiar with is treating cancer with high-dose vitamins. It's definitely a sub-area of a group of naturopathic doctors who really focus in on treating cancer patients. My limit is that I will take a patient that has a protocol and initiate that protocol, but I'm not going to be someone managing that case. But if you are looking for high-dose vitamin C for cancer treatment, that can be done. And it's really just 50 grams to 75 grams of vitamin C in a bag with a little bit of calcium, a little bit of magnesium, and it's meant to go in there and kill some of the cancer cells. So that's not an area that I'm focused in on. The area that I really know a lot about is the adrenal glands, which I was talking to you about, so the use of vitamin C and the B vitamins, and the immune system, so helping the white blood cells work. Common times that I would tell patients, oh, come in for a vitamin shot would be before and after a plane trip. So if you're going to be in the plane, that's a time where you're enclosed in, the air is recycled, and you're greater risk of picking up an infection or picking up something. So if your immune system's strong, if you're well hydrated, you're less likely to get sick. So if you come in before your flight, come in after you're done, get boosted with a Myers cocktail, that can make your chances a little bit better for not picking up anything. So I talked about the Myers cocktail. The Myers cocktail takes anywhere from about 15 to 20 minutes for it to infuse. So you come into the office and you sit down and you get your blood pressure taken, get you some water, make sure you've eaten some food, and we do the intravenous through a vein. So we'll actually access a vein, usually in the arm, and most people will do a butterfly, some people use a catheter, but for a smaller drip like a Myers, we would use a butterfly needle. Pretty painless, a little bit discomfort if you're fearful of needles, but within 15 to 20 minutes the drip is over. People talk about feeling warm. The magnesium, when it circulates through the body, dilates the blood vessels, gets you feeling pretty warm. You can smell and taste the B vitamins, and that's because the B vitamins are circulating through the blood, and you've got capillaries everywhere, and the capillaries in your nose will off-gas the B complex. So it's almost as if you are eating a multivitamin. So yeah, you can get a little bit warm, and you can taste the vitamins. The effects can be either immediate or delayed. So some people notice energy right away, some people notice energy a few days later. Some people actually notice really, really low energy and feel like as though they've need a nap. For those individuals, it's mostly because we've been giving them so many vitamins, it started to kickstart their metabolism, and their metabolism has almost been in a rest mode. So it's like you've kicked their metabolism, you've almost made them run a marathon, so they're a little bit more tired. It's a good sign though. How many times a week would you get a Myers cocktail? Well, like I said, some people would come in only if they fly or if they feel sick. Some people come preventatively once a week. Some people will come for a month and come twice a week. It really all depends. Can you overdo IV vitamins? Absolutely. If you're not getting a beneficial effect from doing it, don't do it. You are going to pee out the vitamins, but here's the thing. The vitamins are going to still do their job. They're being absorbed. They're going right into your blood, so they're only getting through your kidneys because they're being filtered. So they are doing something, but you are peeing a lot of the vitamins out. It's almost like you're storming the body with 1,000 troops that are coming in, versus if you just gave an oral vitamin and you had 10 troops. So yeah, you're gonna pee out 800 of those troops, but can you imagine 1,000 troops going down to support the system versus 10? You're gonna get much more of an entourage effect by having a high dosage of vitamins in your body at one time. Danielle, how's it going? Are the kids watching? The other one we can talk about are the just B vitamin shots. So who has ever heard of getting your B12 shot? So B12 is a cool vitamin. There are different forms of vitamin B12. There's methylcobalamin, there's hydroxycobalamin, and then there's cyanocobalamin. So medical doctors typically use the most common, most inexpensive form of cobalamin, which is cyano. I would say look for the methyl or the methylated form of cobalamin if you want to get a good form. And these are usually done just either in the arm or just in the upper part of the buttocks. So they're usually a mixture of B12 and B9. Sometimes there's a B complex in there as well. Another shot that has become a little more popular lately is the glutathione shot. And glutathione is an antioxidant. It helps to boost the liver's detoxification pathways. So there's phase 1 and phase 2 detoxification in the liver. It's how the body takes complex molecules and either makes them water soluble or fat soluble so that they can be integrated into the body and excreted. Most of the time our detox system makes drugs less toxic. Sometimes it makes them more. And so glutathione just helps to ensure that pathway is working well. And so these are just generally a push, takes 10 to 15 minutes, and the glutathione shot can be added onto any of the other IVs that I was mentioning. The last thing I wanted to talk about that is a general IV that you would find at most or many naturopathic doctors' offices, especially out here in BC. If you're in a different province, you may not have the same, the doctor may not have the same scope, they may not be able to do the exact same type of services, but generally chelation therapy. So chelation therapy is an IV, so again it's going to go into the vein. It takes a few hours for it to drip, and what it does, it goes in and it claws, it pulls out heavy metals. And so individuals that have either had heavy metal toxicity, if they've been living in an industrialized area, which many of us have, expose themselves to certain industrial solvents, we can test for those, and then we can actually pull those out using specific agents for that. The other area that we can do chelation for is cardiovascular health. So if you are suffering from angina, if you've got any blockages in your coronary arteries, I talk a lot, don't I? Talk really fast. The coronary arteries, they can be slowly shrunk by pulling the calcium out of them. So the plaques that exist within the coronary arteries aren't just cholesterol. They're platelets, they're scar tissue from the blood vessels, and calcium, and a bunch of other things. So we can chelate out the calcium from that, we can shrink those plaques and improve perfusion through the heart. So in a nutshell, those are the main IVs, and in my office, I actually do two other specific type of IVs. I like to focus in on the mental health addiction aspect, and so I work with amino acids, customizing specific formulas for patients to help them either balance areas of their brain that are responsible for some depression or anxiety, or dealing with addictive natures. So that's about all I'm going to talk about with the IVs. Where do you find out more about this? If you were to go to Google IV vitamin therapy, Google Myers cocktail, MYERS. I'll write things down. If you have any questions about vitamins and whether there's something that you would even consider, send me an email, send me a message. I'd be happy to answer that for you. I want to remind everyone that I'm going to commit to this 5:30 time Pacific Standard. I think in September I'll be moving it ahead a little bit, meaning a little bit earlier in the day. But for now, it's going to be 5:30 next week. I have no idea what the topic is going to be. I always want to show people new blood tests or new little tools that we use in the office. So I may think of something like that unless someone sends me a message suggesting a topic. So that can be a medical condition. It can be just some suggestions for living a healthier lifestyle. I'd be happy to help out anyway. And looking for new creative ways of engaging with patients and for you guys. So again, my name is Dr. Aaron. I like to think of myself as, the Urban Nat Doc. That's how you can find me on Instagram. It's really warm here in Vancouver. I'm wearing my little tank top, came home from work, and I'm gonna go outside and enjoy the sun. So everyone, thanks for tuning in. Ask me questions, send me messages, and share the videos if you like it. Take care, guys.